Hi, Dr. Hobie Fuerstman with Preventive Medicine, here again to talk to you today about an emerging condition that I'm seeing more and more of in the clinic. This is known as COVID long haul syndrome. Clearly, this is something that has only existed in the past few years during our COVID era. As things have progressed from there, we've seen people who have suffered a longer term illness from this virus. A little hard to explain at first, a little hard to understand, but people who are infected with the virus, whether it is a severe or mild infection initially, can develop a constellation of symptoms that can look a lot of different ways, but often doesn't exactly make sense based on what they initially experienced. So I'll go over a little of the biophysiology of how this happens, and then we'll get into what we can do about it. So essentially, when you get COVID or an infection there, you can often see the viral replication process through the mRNA. mRNA is a protein signaling molecule in the body that can be produced in higher levels in response to a viral infection. Now that's all fine, that's a natural process. We don't love it, but it happens. The problem is when a different type of RNA gets produced as a result and this pattern continues. That's known as microRNA. So this is actually a different type of RNA, similarly related, but has a different pattern. MicroRNA signals for inflammation specifically. Now, when microRNA gets signaled indefinitely, that means indefinite inflammation, indefinite irritation to different molecules and parts of the body that can cause a lot of different problems. Fatigue is a common one, muscle aches, inability to exercise, headaches, down mood. It really looks in a lot of different ways for a lot of different people, but typically occurs within weeks or months after a COVID infection. So if this is something that rings true for you, then you're probably wondering what to do about it. As we are more and more acknowledging this syndrome exists, that's a great first step, but unfortunately, that doesn't lead to the treatment options in most clinic spaces, as a lot of people haven't really fully understood how we break this chronic inflammatory pattern and cycle that happens in the body. Step one, honestly, is proper nutrition. Getting the body to heal itself requires anti-inflammatories, nutrition, and other things that can really allow the body to heal itself. This looks like things like zinc, like magnesium, like omega-3s. I have a lot more information about the specific supplements on the website, and I would encourage you to take a look there as well. Beyond that, there is a specific treatment protocol that we can get into in a lot more detail if this is something that's ringing true to you. That looks like things like vitamin C, glutathione, and a specifically tailored set of supplemental protocols, nutraceuticals, and other additives that can really allow this process to be broken and allow those markers of inflammation to come down and get your body healing itself more properly. So if this is something that rings true for you, someone you know or love, send them my way. Tell them to give me a call, email, check out the website, the blog for more information, and just reach out. Really don't want people suffering any longer than they have to. And that's part of why I'm here.